Do you suffer from pain, numbness, or tingling of the hands or feet or both, known as peripheral neuropathy? Hi, my name is Dr. Eugene Wada. I'm a chiropractic physician with hundreds of hours of postgraduate studies in neurometabolic care. There are thousands and thousands of people out there suffering from the same condition that you are or a loved one of yours. So let me know that you're not alone. Okay? I've helped many of my patients with peripheral neuropathy, and so there is hope. There's hope for you, especially for those who've been to doctor after doctor and still suffer with neuropathy. There are 3 questions you need to ask yourself. 1, how long have you been seeing your doctor for this condition? Number 2, what exactly has he done for you? Number 3, what have the results been like? Now there's an old saying, if you keep doing the same thing over and over again and getting the same results, then that's the definition of insanity. So if you keep going to doctor after doctor and getting the same results, then it's insanity. So let's talk about neuropathy. There are 3 classifications of neuropathy: slight, moderate, and severe. In a slight category, this is when you have a slight maybe pain, numbness, tingling of the hands or feet that isn't really interfering with your daily activities. It's not making an impact on your function. Okay. Number 2, moderate. This is where you have impairment. You're not able to do the things that you were able to do as well as you used to. Maybe you're still able to function, but you're not able to do it because of this problem. Say you can't golf as well as you used to, or work is harder to do because of this problem, or you're having difficulty walking. And number 3, severe. Severe is the most, that's the worst category, of course, and this is where it has such an impact on your life that you can't function anymore. You can't play golf, you can't go for hikes, you can't play sports, you can't do whatever you want to do like you used to. Maybe you're walking with a cane, a walker, or maybe you're even in a wheelchair by now. That's severe. So this is the 3 categories, and you need to sit back and try to figure out what category you're in: slight, moderate, or severe. The thing with peripheral neuropathy is it's a progressive condition, and with this progression, even from slight to moderate severe, if you're in a slight category, then you think you don't really have to do anything about it. Well, you're going to have to wait till you get to moderate before you do anything. Well, when you do, it's going to take longer, it's going to take more treatments, it's going to be harder to get you back to slight. And even when you get to severe, if you're at severe now, you're going to have to go under more intensive care for that to get you back to functioning and improve on your quality of life. Now, you might ask, well, how do I treat this, and how do I treat it so successfully? I don't treat a diagnosis. I treat the person. I treat the person as a whole person. I take a step back and look at them. I treat neurologically, metabolically, and structurally. So neurologically, what does that mean? We have to look at the brain. Your brain is your computer. It takes care of everything in your body. So if your brain isn't functioning well, then it can cause neuropathy. So we ask ourselves, well, what does the brain need to survive? It needs 2 things. It needs fuel and it needs activation. Fuel comes in the form of glucose and oxygen. Activation is stimulation to the brain from your receptors in your body. So when we look at you metabolically, we have to look at your blood glucose. How much glucose are you getting to your brain? Is your glucose less than it should be, or is it more, or is it normal? Well, the glucose goes to the brain and it mixes with oxygen. So we have to look at oxygen also metabolically. With oxygen, we have to look at anemias. You may have an iron deficiency anemia. Iron binds to oxygen and it takes it to every cell in the body, especially the brain. So if you have an iron deficiency anemia, then you don't have enough iron to bind to oxygen and you have less oxygen getting to your brain. Now when the glucose gets to the brain and oxygen gets to the brain, it acts like a carburetor. When you get gasoline and oxygen in a carburetor, it combusts. The same with glucose and oxygen. In your brain, it combusts. But if there's a wrong mixture of gasoline and oxygen getting to your brain, into your carburetor, then it'll backfire. Your car will backfire. And the same with brain. The brain, if you have glucose and oxygen that's not mixing well, then it's going to cause a misfire. This misfire will affect the programs in your body and it can produce neuropathy. Okay, so we have to look at you neurologically, we have to look at you metabolically, and last but not least, we have to look at you structurally. Structurally, we look at, say if you had pain and numbness in the feet, we have to look at your lower back. That's where the nerves come out of your lower back. You may have a degenerative disc, you may have a herniated disc or prolapsed disc, protruding disc, which is causing pressure on the nerves. So we have to rule that out as a possible cause of your problem. So when was the last time your doctor ever looked at any of these aspects towards your health to try and solve your neuropathy? I can bet they haven't. And the reason why is because they prescribe medication. And the medication is to try to numb up your problem so you don't feel the problem. Mask the pain, mask the symptoms. Well, we work differently here. We try to uncover the cause of why you're having this problem and try to address that cause to alleviate your symptoms. So basically there are three things I want to do for you. I want to reinvent your life. What does that mean? I want to get your life back to you, give your life back to you. I want to get you back to health, and I want to get you functioning better, and I want to improve the quality of your life. And number two, I want to have a positive impact on every person I meet. And every person that I meet that I can help, I want to help. Number three, an exit strategy or exit plan. What does that mean? Well, that means right now you are caught up in the medical cycle, as you say. Maybe you've gone to your general practitioner for your neuropathy, and he sends you to an orthopedic doctor, who sends you to a neurologist, who sends you to a pain management clinic, and maybe they sent you to a psychiatrist because they think you're crazy. Well, you're not crazy. You definitely have a problem. It's just they don't know what the problem is and how to handle it. So, those are the three things I'd like to do for you. To get you out of that exit plan, I want you to come here. I want you to talk to me and get an idea of how I can help you with your problem. So, in order to do that, I'm offering you a free consultation. This consultation is to determine whether or not you're a candidate for my program, whether I can help you or not. If I can't help you, then I'll be able to tell you that. But if I can help you, and I feel I can, I will tell you that too. So in order to schedule your appointment, please call us at 310-516-9989. I hope to see you soon. Thank you.